Good evening, afternoon, everyone. I know lunchtime, sleepiness, drowsiness, is that what you're feeling? So we'll keep the talk interesting and for a very young audience, So let me start by asking, how are babies made? You know, how are babies born? I think everybody knows the process. But when I was younger, I used to ask this question to my parents, and I would get all these whimsical answers. A stork came in and delivered us in our lap. You were born from a clay pot, like in Mahabharat or in Ramayana, or you were delivered by God's blessings. He just blessed, and then you're here. So obviously, curiosity gets the better of the cat, and when you're in your teens, you're still asking that question when you don't know the answer. And when I again asked, this time they were more candid enough. Your mom and dad kissed, and here you are. Or mom and dad went in the room, and here you are. But that's again those futile answers that will still keep on getting your curiosity. How are actually babies made? Okay, so I am here, but what was the process? How did we come into being? And then, so there comes an age that you have to stop asking these questions and start doing your own research. And when I was in my late teens, probably like you guys, you did yourself, magazines, cool stuff on the internet, you did that. But that still did not give me the answer for the process. What is fertilization? I was still not getting that answer. And come what may, we'll go ahead and discuss that what is actually fertilization. But let's move a step back. We're talking about infertility. We're the most populous country in the world, 1.41 billion people, or 4 to 9 billion people on Earth. Is there infertility an actual problem? Or isn't overpopulation the problem? I get this question a lot. Where is this problem? So when you're practicing, when you actually meet couples or see people who've been married for years, 5, 6, 7, 10 onwards, and who've been yearning for a child, that is where the problem lies. I'm sure all of you have someone the close who have gone through a healthcare debacle. Some problem, could be cancer, could be any other thing. Let me give you the stats. 1 in 8 people probably suffer from cancer or any other ailments, whereas infertility is 1 in 6 couples. That's how high the number is when you're talking about that. So I'm very sure that if you look at it, if you're having couples around you who have been married for long years, they are still trying to conceive. That's where infertility. What is infertility? By definition, it's a couple trying to conceive, having active intercourse for 6 months or more, and is still not able to get pregnant. That is when you declare a couple infertile. So that's the nutshell definition. It may seem easy. How does infertility happen? For a basic fact, you would say all the basic reasons. You're smoking, you're drinking, your lifestyle, you have stress. These are all the basic reasons that comes into mind for any lifestyle-related disorder like infertility. But that's not the only reason. There's so many hidden factors that you probably should be aware of. I'm sure that none of you think that the air we breathe in, the environment, the makeup you put on, the lipsticks, the fillers, the tight underwear for men, the pollution that you wear, all of them have an actual reason. There are studies pointing out that even the healthiest of men who are not smoking, not drinking, have a balanced lifestyle, have a healthy diet, they have been able to have infertility. Let me give you a very astonishing number. Your grandfather would have double or triple the sperm count which you have. That's how the decrease in male semen count has been from within 50 years. WHO used to tell us that 100 million is the sperm count for a normal man in 1970s. It is now down to 40 million. And men are generally more stronger than their predecessors, taller, faster, good looking, better looking, whatever. But biologically, hormonally, you are going a generation backwards. And that's why the increase in diseases. Going pertinent to that number, there is no cause for infertility. It can happen to the best of us. It can happen to anyone. Especially in our Indian society, I would see, or you would see yourselves, if a couple gets married, the next pressure from family, peer, colleagues, grandparents, parents, whatever is, Okay, time to reproduce, time to go ahead, It's been, what are you guys doing? It's been 3 years. As if 3 years means the end of life or something is going to happen within 3 years. That's the pressure or that's the emotional turmoil that a couple goes through if they're married. But infertility does not come when you get married, reproduce. As I said, whatever the body is undergoing, it's going when you are young, when you're in your teens, when you are very healthy. You would remember, or probably, I don't know your parents have said this or not, but let me be saying that girls are taught not to get pregnant in their teens, and boys are taught not to make girls pregnant while in their teens. But reverse happens when they are actually trying to reproduce. Within a decade, can you imagine, say from 18 till 28 or 30 onwards, that's how the biological clock completely reverses. It's a complete downhill from what you have in your 1820s to what you're going in your 30s. How many of you guys would you have undergone a sperm test? Even if you have, you would not raise your hand. I know that. I was just asking for that matter that it is very normal but embarrassing. Men are unemotional. Men don't share. So let me tell you the basic parameters for a sperm test is semen analysis. What you do is motility, morphology, and count. The three basic parameters. But even men who have undergone these tests and who are facing, they can share everything with their friends. They'll be completely open. They'll talk about drinks. They'll drink with them. They'll discuss their whole past school life, college life. They'll be completely open. But they will not disclose this information because it men, the ideology and psychology is, I'm not a real man if I'm facing infertility issue, which is the biggest taboo. It can happen to anyone. This does not make you less of a man, or we'll come to women on also, but as infertility, again, the mistake, the common misconception was 50% of the infertility or infertility is due to women, which is not true. 50% of infertility is due to men. When you're clear on these concepts, men require that emotional support and that bond to actually discuss what they're going through, what they're feeling. But they do not, because they take it on their pride. They take it on their self, that it's not an issue that I can fathom. This is where the biggest taboo for male infertility of a man lie. We need to go beyond and see beyond this, especially for all the youngsters that are out there or listening. So we see a lot of patients every day, and the best thing is, as I said, whenever a couple gets married in India, the pressure that they go in, they don't come to the doctors first. There is a line of people that they'll go to, the family, the friends, the temple, the babas. After all of that, when they have given up hope, it's been 4 or 5 years, then they go to a healthcare facility or a doctor to finally disclose. Once they've gone through, let me tell you very finally, that you'll get advice from everywhere. Sooner or later, whenever you get married, the first advice from your elders or your friendly friends, start taking vitamin and zinc supplements. I'll order from Amazon from you. I'll start eating organic vegetables instead of, certain mandi vegetables. Start taking whey protein. I've heard our patients doing that. I'm taking some special whey protein as if. Some of the relatives order special Chinese ginseng tea, so boost their fertility. And to top it all, this is the icing on the cake. There are people who have gone to sages in Baba to eat a special samosa with only red chutney, not even green, red chutney to increase or boost their fertility, and tathastu, bachcha aa jayega. Doesn't happen, my friends. This is just the misnomer and the taboos that you're going through with it. It's a medical condition. It's a treatable medical condition. You just need to consult. Very four simple parametric tests is what we do to understand a future, life cycle, or what's the problem that we're saying. The first question is, how active is your sexual life? How many times frequency? As I said, if it's 6 months, gone beyond 6 months of active intercourse, there's infertility. The semen analysis, which I've already talked about, and there are two tests for females. The AMH blood test, which tells us how much of the ovarian reserve you have, and an follicle count, an ultrasound, which you do for females. This is enough. These are like 15, 20, 30-minute procedures, or even a blood test. I mean, lesser than that, that we can give you a perfect idea of what is wrong, where is wrong, and what is the treatment protocol to treat you. The basic simple premise, the first is with medication, which is called ovarian induction. The second is called intrauterine insemination, which is where a male factor infertility is there, where we put the semen into the woman's uterus. And the third, which is the gold standard form of treatment, IVF, in vitro fertilization, where we are mimicking the biological process inside the body into a laboratory. What happens inside the body is the semen and the oocyte, they fertilize together, they make an embryo. We do the similar process outside in a laboratory, and that's why the common generic term test tube baby. No matter, there are no test tubes used, there are petri dishes, but since it's been going on for donkeys of years, so let us presume it's a test tube baby. Funny fact, the first IVF baby was born in 1978, Louis Brown in UK, which was herself an IVF. She has reproduced now. She has 5 or 6 or 10-year-old kids now. So it's an age-old technique which is now being proven, which is now very safe and easily affordable for everyone. So when I said that let's go back to what men don't share, you know, I saw a patient once who had a problem with, say, the motility, and I said that probably you need to do some things, take these medicines and go forward. But the person went into a cocoon, went into its own nutshell. To basic, in layman terms, the sperm was slow. And his name was, I mean, his general perception was, Dr. Saab, what do I tell my friends? I start running a race, I reach the finish line and my sperm is still there. That's the basic kind of notion that people are still hung up to. What is their problem? So, taboo, ostracizing, maligning, shunting people who are facing this, we need to lend a hand to all these people. We need to go beyond this because we know the treatment is available. You would see there are genetic diseases which we can have cure to. There are generations of people suffering from sickle cell anemia, thalassemia, Klinefelter syndrome. They were not diagnosable then. Not only are they diagnosable now, but they can be removed from the whole genetic pipeline from your great-grandfather to grandfather. If you're suffering something, we have evolved so much in medical science that we can be 100% sure of removing that single genetic strain and giving you a progeny or reproducing without that genetic disorder. It has evolved to that level. It's just that people are still so fixated and so turmoil that they're not ready to accept that they have undergone an IVF treatment or not. I would see people come into our OPDs wearing a cap. The men are wearing caps, trying to hide their faces, not show, oh, that we are here, and then going, hush, hush, please don't tell. And even if, when you start discussing and there's some common family person that you know of, you know them socially, please don't tell them that we are here or we are doing this. It is so unacceptable to them for a simple fact that it can happen to anyone. It does not degrade your dignity. It does not make you less of a man or a woman. It does not make you susceptible to any harm. It just happens. It happens to anyone. But people, that's where awareness and your help is required to go beyond certain things. Women, your biological clocks move the other way around. The more you focus on your career, your biology is going downwards. What do you do then? How do you preserve your fertility? Will you be going for egg freezing, which is an option? Generally, women don't, again, because it becomes a taboo. That can we freeze our eggs? It's like a lifeline. It's like an insurance that you do that no matter, and frankly, there are celebs who have done that. I can name Priyanka Chopra's to all these celebs in the world, who have actually undertaken this. Lara Datta, all of them, because they were focusing at certain point of time, because your biological clocks work differently, that you cannot. But you need to discuss this. You need to be made aware of your choices. You cannot just at probably 35 say, now I am ready, whereas your peak fertility period was from 25 to 30. Be aware of the choices and the medical treatment that you have. Do not think that it is something to be ashamed of or if you discuss with someone. It's a very powerful tool in your hands. Why are we so tabooed about infertility? Give you understand why? Why does everyone require? We are not Mughal Shah emperors, Aurangzeb or something, that I have my progeny, legacy. I don't have to leave a Taj Mahal to someone. But the basic essence of mankind is how are you remembered? Not by what you've done, not by what your future holds, but who are you leaving behind? They remember you. And that's why everybody is taking a fertility treatment because they want someone to remember. Prime example for you young fellows, Sidhu Moosewala. We have a law in India which does not allow fertility treatment above 55 years of age. But in social media, if I, as a doctor, would have treated that patient, my license would have been cancelled by now. I would have been out of a job. My clinic would have been shunted. I would have been behind bars also, very frankly, because the law doesn't allow us, and it's jail. But a rock star died, or a Punjabi pop singer died, and the enormity of the people's support that the parents have actually given birth through IVF treatment to the baby again. That's the kind of, there's simplicity in its beauty, and then there is an actual dilemma question about the age factor also. So for you, just giving in a nutshell, that there's no dearth of miracles happening in our field, in our industry. The miracles are not being made by us, are being made by you guys, by the powerful choice that you are making, by the fertility that you have in your hands, and you taking the power within yourself. The awareness that you go with today, that the life choices you make, the lifestyle choices, the insurance choices, and how do you preserve everything, that's only and solely with you, and you have the power. So I would like to finally conclude that let this be a talk, not only for a workplace or for between colleagues or between people undergoing infertility treatment. Let this be a part, let fertility be a part of your college, your school curriculum. Let this red dot be the final dot where we stop this malignancy about the process or a procedure, that if someone is not able to reproduce, they have done something wrong. Let us take a vow that we will not ask nonsensical and stupid questions that, oh, you've been married for 5 years, why aren't you not having a baby? Oh, you're already 37, why are you not, what have you done? Where is this? Let's end this. Let's end this malignancy and let's accept. Because the journey is tough, but the outcome is beautiful. And that's always been in IVF, you know. That's always been with any kind of fertility treatment. Even if someone undergoes egg donation, sperm donation, or surrogacy, the most beautiful outcome, if you gather those two tiny hands and two tiny feet in your palm, there is nothing more beautiful in the world, and no picture can capture that inner beauty when you see that. So, guys, let's eradicate the stigma of barrenhood and let's stop the shamefulness that we give to infertile couples. That's my message to you, and thank you.